So, you seem very knowledgeable about environmental affairs.
Mm-hmm. Yes.
What what is Louisiana's situation, kind of, with regards to the environment and its recent history? We've had a couple of events in our
The
recent
oil
history.
spills and everything. It's really, I think like a lot of people from Louisiana are really aware that, like with Katrina and the oil spill, we need to do something. But at the same time, most people in Louisiana are very dependent on the oil economy for jobs. So it's kind of like, you know, it's like kind of like it being in an abusive relationship, and you're like, but I love him, blah, blah. Or like, and then he hits you or whatever. But that's kind of a bad analogy. But you know what I mean. It's just like,
Right.
like most of the jobs in Louisiana are from oil, and with the way Bobby Jindal is, like putting, with the budget cuts and everything like that, it doesn't seem like he's trying to find many other sources for jobs besides oil and and criminal justice. I guess I don't know, and so I think a lot of people in Louisiana are aware that, you know, there's been a lot of, like we have way too much dependency on oil, and there's the oil spill and everything, but I don't really see many of them doing anything about it because of the dependency on the jobs, at least.
Right.
But I could be wrong. I don't know. I hope I'm wrong. So.
Right.
But I think like in New Orleans, there are a lot of different like environmental nonprofits that work on stuff like that.
How do you feel about the students' role at Southeastern in terms of their capacity to affect the system itself at Southeastern in terms of, you know, maybe what they have to say about classes? Do they get
Yeah.
to the role they play in their classes in terms of how much they determine in
Mhm.
which direction their classes go, for example?
I think like anytime the students actually like get together and voice their opinion like strongly enough that it could result in change. But right now I feel like students aren't really aware of their own power, because I've had that, I've dealt with that with the Real Food Challenge, because I'm like kind of the campaign leader with that, and a big part of that is educating students about the industrial food economy and how to change it. But the hardest part is really how to change it, because most students don't have an awareness of how much power they have as a student in affecting their campus dining, and be like, look, we're the customers and we want more local produce because we want to support our local economy. So like really the hardest part is getting students to realize that and be like, hey, if we all like, you know, sign this petition and all write letters, you know, or you know, stuff like that, then you could change something. It's just getting them to be aware. It's the hardest part.
So what is our power as students?
Well, we're the customers pretty much, and I don't know, I kind of feel like students forget that, because like ultimately the university is supposed to be for us, but
Right.
most of the time it seems like faculty and administrators control everything, and students just have to be along for the ride. But I mean, I don't think students could like, you know, control like really frivolous things like, oh, we want like parties every week or something like that. But you know, like, you know, as far as the quality of their education and like their life, like if they're living on campus, if they're really concerned about something, I think they could change something, and that they should have power over that.
Right. What do you think we have SOTs, what is it, student?
Is that the one where you evaluate your teacher?
You evaluate your teacher.
Yeah.
And how are those empowering, or are those empowering to us, and how effective do you think those are in terms of our student power?
I mean, I've heard from other professors who've given that and saying to take them seriously, and that they really do take into account like what they say, but I don't know if I've ever actually heard like a student that was really particularly bad getting fired over SATs or not. So I'm not really sure how effective they are, but I think some students don't take them seriously and some do and write a lot of comments. I usually try to write comments if
Right.
the professor is particularly good or particularly bad or something, but I'm not, like, I think if they do result in change, like in firing anyone, it takes probably a few years at least. Because you can't, I mean, yeah, I don't know if that's a good thing or not. It's good that that students can give feedback, if a teacher's particularly bad, they should be fired. But if it's like, something like, some of the students can be overreacting on things like, oh, they demand us to go to class every day. Oh, and so you have to take everything with a grain of salt. It's like, rate my professor. You can't pay attention to all the ratings because some of them are ridiculous, but then you have to take seriously the ones that are serious. So,
Right.
yeah. I think like the main problem is trying to realize like which students are really trying to act like adults and which one are still acting like they're in high school. But
Right.
there's kind of a line there in college, like especially for the freshman year. So
You worked on the Real Food Challenge. Could you talk a little bit about that?
yeah, we started working on my group. It was Reconnect, the environmental group at Southeastern, and we've been working on it for about like over a year, pretty much. But we've been in contact with Aramark, our campus dining representatives, for about about almost a year, like 10 months or something like that. And we're basically trying to, we have some local farmers from southern Louisiana, Mississippi that we're in contact with, and we're trying to get the farmers and Aramark, our campus dining, to form contracts where they can get more local and sustainable produce instead of the stuff that's like shipped from California.
Right. What's the role of food in our lives?
Well, I mean, it's pretty much kind of everything, but at the same time, our culture today kind of ignores food. Like, we kind of, in American culture, we kind of just go straight for the convenience food, and we don't really think about, like, we don't really cook together anymore. But food, like, traditionally seems like it's important because it's your fuel, but also it's just part of culture. And I think we've kind of lost that culture and that knowledge of where our food comes from. So, like, our role is kind of to, like, pose that question about thinking about where your food comes and how it affects the economy, how it affects food workers who usually get money about below the poverty line, and they work in pretty bad conditions and everything like that. So it's just like food raises awareness about a lot of different issues like the environment, health, like what kind of chemicals go in your body, or just, anything like that. So it's like the economy, health, and the environment, workers, it's just like, food is just like the center of like all those issues, so. But it's just something we kind of take for granted, so it's kind of tricky. It's everything, but it's not really everything too. Like, people don't think it is everything. They're just like, oh, I'm just gonna go grab a granola bar. And I'm still like that, even though I'm studying this, I still get like that. I'm like, oh, I'm studying food. I'm like eating food in front of the computer really fast because like I'm in grad school and I don't have much time. So it's kind of like, even though I'm learning about this, I'm still kind of like, I don't know. Yeah, it's pretty interesting.
Right. You said, so, I mean, if food can be connected with anything, like what's food's connection to like gender or race or something like that?
Gender or race? Well, like for race, there's a lot of, like, food culture, there's a lot of traditional diets from different cultures. And so like with different races and minorities, you might have different traditional diets.
Right.
Like a certain, like I don't want to stereotype though, but like, there are different cultural diets sometimes, and some are healthier than others. And also like, and that's another thing though, there's also food access, because in food deserts, usually it's, in America at least, it's people that are black or Latino, or people that live in the poorest areas that usually live closer to fast food places in proximity. They're closer to fast food than fresh produce.
Food desert?
Food desert is like any area where there's not much access to supermarkets or grocery stores, usually more access to fast food or convenience stores that usually sell like really expensive, like either really expensive produce, like not the cheaper produce. Like ironically, in richer areas, like areas where people are richer, they have more access to cheaper produce. I'm not sure why. But so usually they have very little access to affordable, healthy food, and more access to a lot of junk food. Right. So that plays an issue of race, because people that are like in America, like say if they're black, they're more likely to be obese and have heart problems because of their diet. But it's also, diet's not all about personal choice. It's all about access and environment too. Like if you're only surrounded by fried chicken and Pop-Tarts and stuff like that, that's gonna be the easiest to get.
Right.
And also it's income. If it's harder to afford the fresh produce, then it's harder to be healthier.
So these areas that are food deserts, is there a correlation between the income level of the housing? Like, is it cheap housing that is located in these areas?
I think, I'm trying to remember. Yeah, I think I read something like that. I don't remember how exactly they figured it out.
Right.
But yeah, they said low income area, so I'm assuming that means low income housing or
Right.
yeah.
Definitely.
And they measured it by miles. And I think there was one study in Chicago they did where they compared miles to the nearest fast food place compared to the nearest grocery store area. And like areas where there was mostly more white people, they were pretty close to grocery stores, but area where there was mostly black people, they were a lot closer to the fast food place.
Right.
So
One last thing I wanted to ask about was healthcare in the United States. First, have you been able to afford medical care?
well, I think I'm still on my mom's health care plan until I turn 26. I'm not sure if that's changed since the Obama healthcare plan thing. Because I'm 25 right now, and I think I just got it for her dental insurance. But I think I'm still on her health care for like one more, or until I finish grad school, I think. So I'm kind of worried about that because whenever I get finish grad school and if I can get a job, I need to find a way to afford health care, which
Right.
it's I'm pretty healthy, but I don't know what's going to happen, down the road. So
Right.
I am kind of worried about that because it's like crazy expensive. I almost think it'd be cheaper to not get health care and just pay out of pocket because even if you do
Really?
have health care, like my mom has a pretty good health care plan, but you still have to pay a lot of money out of pocket when you have any kind of checkup or anything like that. So
Right.
I don't know. I'm more about preventative care and like trying to eat as healthy as I can. Because like that's like the only thing I can really do if I don't have health care, so.
Right. And how would you feel about a universal healthcare system in the United States?
Like, from what I've read about universal health care in other countries, it doesn't seem like a bad idea to me. It probably depends on how it's implemented. And I think, like, in a country like America, people are going to freak out about that because they're like, oh, communism or whatever. So it might be good to, like, have some kind of choice. Like, you can either opt into this free or subsidized healthcare system, or you can pay more and have some kind of different healthcare system. Something like that might work.
Right.
But I would really much prefer healthcare not being controlled by businesses. That's how I feel about it. So,
Right.
because I don't think public health should be in the hands of pharmaceutical companies and insurance companies.
Whose hand should they be in?
The medical well, I won't say medical professionals because there are some people that more traditional people that have their own way of doing things, but just people who generally want to treat people's health and see that people are healthy, not just insurance companies. I don't know how to word that, so. But yeah, the people's hands. Like people shouldn't worry about having to get health care if if they already have some kind of condition and they can't afford to get some kind of treatment, so.
Right.